Hello, and welcome to today's webinar. I am Barbara Trattler, Director of Clinical Education for Advanced Sterilization Products, or ASP. Thank you for joining us for our sixth webinar titled One Hospital's Story of Transition. We understand that with less than 5 months until the FDA-mandated August 2011 deadline to transition from the STERIS System 1, this can be a confusing and hectic time. Many of you are under increasing pressure and have requested to hear about case studies to help you see how a transition can be done successfully. ASP has helped hundreds of hospitals nationwide adopt terminal sterilization, and we are delighted to share one of those stories with you today. This webinar features Memorial University Medical Center in Savannah, Georgia, and its recent successful transition to terminal sterilization. We hope the experiences shared by the hospital staff can help educate you to make informed choices for your facility. As you try to determine the best alternatives to fit your sterilization needs, we at ASP are here to help you navigate the choices. The Memorial University Medical Center is probably much like many of the facilities you all work in, a busy surgical center where the operating rooms cannot be disrupted during a transition. It is a 530-bed academic medical center with 21 ORs that perform more than 20,000 surgical procedures each year. The hospital has been using STERIS System 1, or SS1, devices for 15 years, and had 6 SS1s outside of operating rooms within the sterile core. Through a well-planned and coordinated effort, Memorial University Medical Center transitioned to a terminal sterilization system using STERRAD NX systems. All surgical teams were trained early, and the unity of effort created a smooth transition without risk to patients or undue inconvenience to staff. You will now hear from OR Manager Kathy Browne, Sterile Processing Manager Aaron Baydon, and Instrument Technician Cynthia McKine as they share their transition experience firsthand. Following this presentation, we will also be providing answers to some of the most pressing questions we've received from you.
Well, we got the mandate from JACO, and we went, oh my gosh, what are we going to do? Because we are a level 1 trauma center. We have 21 operating rooms. We do anywhere from 50 to 80 cases a day. We had 6 Sterises, and we were going, oh my gosh, what are we going to do? Because we use the Sterises nonstop, so there was no way we could get away, could not use them. Mm-hmm. So we were almost in a panic mode. And so we had to immediately go into almost an emergency meeting to figure out what we were going to do. We developed a task force, and in that task force, we empowered our SPD manager to look at all of our options. The task force included several different team members, and we looked at the different options, including the STERRAD. We went ahead and took out the 6 Sterises and purchased the 5 STERRADs to replace them. And we did that on a transition basis, and Aaron was in charge of it. Due to his competencies in sterilization, he was able to do that for me. And the reason this is so big is because this is all in the OR. Mm-hmm. 21 rooms running constantly. He did this on a transition basis. The rooms are running, he's having these machines taken out one by one, the OR is still running, traumas are going. Aaron is just a gem. It was just incredible how wonderful this worked. So we got them all in, everything went perfect. Because he's in charge of sterilization, that's his competencies, he's perfect in that. They wash the instruments, they wrap the instruments, they put them into the STERRAD, then they bring it to us in the room, or they put it on the shelf for us to come out and get. It is absolutely seamless for us, and actually it gives our team more time to take care of the patient, and it gives us more time to have more patient safety time. So I can't say enough about how wonderful it is for us at Memorial. I'm really, really excited about it. Aaron's staff actually took on more of their functions, and they would actually take the instruments, wash them, wrap them, and then put them in the SteriRad and then bring them to our staff. So it actually has made the staff in the OR's work easier. When they realized that their work was going to be taken away from them and that they were going to have a little bit more time to focus on their work in the room and the patients and the patient safety, then they were actually relieved and happy about it. Productivity-wise, we can actually go to the shelf and get the instrumentation rather than just in time. So really it's helping our productivity. It has not increased our cost, and it has the availability of instruments has helped, has increased. It has actually been seamless. It's just been very, very nice for us. In the beginning, they were nervous about not being able to put their own instruments in the Steris because that's what they were used to. But now, because they can give their instruments to the SPD staff, it gives them a little bit of extra time, and now they can go back in their room and work on their case, and it gives them more time for working on their case and actually having time for their patient and patient safety. Patient safety is always the forefront of an operating room nurse and for an operating room nurse. So terminal sterilization is very, very important for us. It is the first thing that we look at when we pick up an instrumentation tray. I would recommend SteriRad totally and for any institution. I feel like it has been a seamless transition for Memorial to go to SteriRad. I feel that it has been a very good practice for us to transition into SteriRad from the Steris usage, and I feel it has been a very good patient safety transition for the patient, and I would highly recommend this for anyone to transition into for their patients, and that it is also something good for all of the workers. I can see that because whenever I was a employee and used the Steris and had to smell the peracetic acid and work with it and smell the fumes and worry about having to dilute it and worry about what the workers were going to have to, be exposed to. Those were things that I worried about, and I can see where the SteriRad is safer, and I can see where it is good for the patient. And I think that this is a very good product, and I would highly recommend it for patient safety, for terminal sterilization, and for productivity, and for throughput, and I think it is a very good product. As manager of the operating room, I feel that we have raised the standard of care here by using the SteriRad. I feel that we are always looking and trying to take care of the patient and raising the standard of care for the patients and always putting the patient safety in the forefront.